But hello, everybody. Thanks so much for tuning in. This is really such a very important topic that we're going to be covering today, hearing from several Vermont nurses of varying backgrounds on their role in addressing the COVID-19 crisis and in the recovery process as well. So before we get started, I just wanted to give a big thank you to all the nurses on this webinar and around Vermont and around the country and around the globe for that matter. These days, you all are going by healthcare heroes, and it's no exaggeration. This crisis is really showing us as a society, I think, the extent to how valuable our nurses and other healthcare professionals are. So thank you so very much. And here at VPIRG, we're pivoting a lot of our own priorities to be more focused on the COVID-19 response. We're trying to make as many resources available to Vermonters as we can and talk about the various ways our society is being impacted by the crisis. So this webinar series is just a part of that work. And if you're interested in finding out about some of the other work that we've been doing, you can visit our website at vpirg.org. We have a lot of other webinar videos that you can watch there, such as the one we did yesterday with the Vermont State School Nurse Association on Vermont School Nurse Day. So that was a really great one, and it really, I think, showed us all how valuable school nurses specifically are to our state. And so go ahead and check that out if you'd like. Right now, I will go ahead and introduce our wonderful guests. So today we have Clayton Wetzel, Vermont Director for the National Association of School Nurses and Webmaster for the Vermont State School Nurses Association. And he's also a school nurse at Waitsfield Elementary. We also have Cynthia Roberts. She's a staff nurse at the University of Vermont Medical Center in the Surgical Intensive Care Unit and a PhD candidate at UMass Amherst of nursing. And then we have Eileen Gerling, acting president of ANA Vermont, and Meredith Roberts, executive director of ANA Vermont. I'm actually not sure if Meredith ended up tuning in, but she probably is here. And then Carol Conroy, president. Oh, great. So Carol Conroy, president-elect of the Organization of Nurse Leaders of Massachusetts, Rhode Island, Connecticut, New Hampshire, and Vermont. And then Michelle Wade, president of Vermont Nurse Practitioners Association. I didn't miss anybody, did I? Okay, good. So I'll just pass it along. I mean, we're going to talk a little bit about the organizing work that they've all been doing in the Coalition of Vermont Nurse and Nurse Practitioner Leaders. But before we get there, I thought we'd really just set the stage with talking about the fact that it is International Nurse Week, as well as International Year of the Nurse and the Midwife, and just kind of let that lay the foundation for the rest of the conversation. So I'll pass it on to Eileen to give us a little history and background on that.
Thanks, Maeve, and thanks for inviting us to do this, especially since it is the Year of the Nurse and obviously Nurses Week. So for folks that might not know, traditionally the week of May 6th through 12th is the Nursing Week, and that's because Florence Nightingale, our mentor nurse from 200 years ago, is her birth. And so this year, it's the International Year of the Nurse in honor of the history that she really created for nursing as a profession. And I think also the World Health Organization was really interested in supporting the contributions that nurses make to the healthcare system and acknowledging the vulnerability in that system due to the global nursing shortage. Ironically, however, it's also the year of the pandemic. So nurses have a huge role in the energy and the work that's going on, not only nationally, but obviously right here in Vermont. And I think, you know, folks may or may not know that or don't have a nursing history, but Florence Nightingale was really someone that was ahead of her time. In some ways, she was really the first feminist, in my opinion. Maybe it's just because I know her better than some other early pioneers, but she was a wealthy family, but she really was dedicated to her own education. And her father also supported that in the sense of what she learned as a young woman. And so she really forged the areas of public health and epidemiology and sanitation, basically advocating for clean air, clean water. And she was a mathematician in her own right and really was an early formative data analyst for nursing, and really advocating for what she saw as patterns in healthcare and disease, and essentially really was able to communicate that very clearly, even through data and graphs. And she pioneered some early graphs, which, you know, sometimes we don't think of either. So she really set a lot of the foundational work that nurses do today, obviously in addition to bedside care, which is what a lot of people recognize. But nurses are in all fields, as represented by those that are on this call today. So yeah, it's International Year of the Nurse and the pandemic. And so nurses, as you said, are the heroes right now, but I think they've always been heroes in the work that we do, frontline. And so again, just thanks for inviting us. And I'm sure my other colleagues will add to this as we go through some elements of practice that are represented on the phone call.
That's great. And I think we're going to talk, touch a little bit back on how the history has kind of shaped this moment even more as we go on in this conversation. But I'll pass it on to Clayton just to give a little background of the organization work you all are doing together during this time of crisis. But Clayton.
Great. Okay, thanks. So it's interesting because back on March 19th, I had an idea and I called Meredith, and I thought it would be really important to build an affiliation between the American Nurse Association of Vermont and the Vermont State School Nurse Association. So I asked her the question, and she said, well, yeah, that's a great idea. So why don't we try something? And we so it was about affiliation, and we also talked about COVID-19 implications for nurses, and also PPE was starting to become a concern. So we were looking into that. And so that same day, I reached out to the president of the National Association of School Nurses, and I just mentioned it to her, and she reached out immediately to Debbie Hatmaker, the CNO of ANA Enterprise, and said that there was this interest that we had, and they ended up having an email. They emailed each other and then had a meeting on March 24th. And I'm going to do a quote from Lori, but this is from her email. And she said, "Thank you for hearing our concerns of the school nurses regarding the safe delivery of care within our school communities. Clayton Wetzel, NASN Director from Vermont, and Meredith Roberts, ANA Vermont Executive Director, met recently and suggested that there be a shared document that carried the voices of all nursing specialties. And I want to suggest consideration of a statement from the organizational affiliates about the impacts of COVID-19 on nurses across specialties." So Meredith and I already had said, let's go ahead and start working on this. And so we went from the word go, we started working, and Meredith put together a Zoom meeting, and we brought in folks from a whole bunch of different places that Meredith knew. And that really was the basis for the group we're in now. But the idea was we wanted to write a joint statement. And Meredith was already working on a PPE statement that was going to go to Governor Scott. And after talking and working with the group, between March 25th and April 1st, we nailed down language that really wasn't just for nurses, but also nurse practitioners. We wanted to make sure that both of those voices were heard and that we were really presenting one voice. So on April 1st, we finalized the joint statement, and that was sent to Governor Scott. And it was regarding our desire for the inclusivity of nurses in the strategic planning and response underway to contain and manage the COVID-19 pandemic. And we've been meeting weekly since, but to get ANA Vermont, the Vermont State School Nurse Association, the Vermont Nurse Practitioners Association, Organization of Nurse Leaders of Massachusetts, Rhode Island, Connecticut, New Hampshire, and Vermont was amazing. One, that we were able to very quickly coalesce and get a joint statement out so quickly without any argument. It was really, really smooth and easy. And what we have now is built a relationship where when we meet on Fridays, we are hearing from each different organization and things that are happening. So like when the ONL has had things for the Northeast, they've talked to folks from out West when this was first started happening, and they were learning, and they were able to then provide that to other organizations so we could bring it back to our folks within our membership, and it's been really great. So what was just an idea not very long ago has really become something that I feel very powerful, and I feel really lucky to be part of this really amazing group of nurses, and in a way, part of their organizations. So that's kind of the history of where we are today.
That's great. And it sounds like a lot of the work that you're doing is kind of working as a model for other states. So that's really great. We always love when Vermont is a leader in all things. So, I mean, as we were talking about, it is a time of crisis, and nurses are one of the most important healthcare professionals on the front lines. So I was hoping, Michelle, you might discuss a little bit about what that is looking like right now and nurse practitioners' role.
Great, thank you very much, and thank all of you. I agree with everything that's been said so far. I think for us as nurse practitioners, the things that we've seen and come across is a whole new viral illness that we knew nothing about, that we had to quickly learn about, fall back and re-educate ourselves about, and then figure out how to help our patients with it. At the same time, the national government was realizing that we were in a state of crisis. The state of Vermont was realizing we were in a state of crisis and shutting down primary care, shutting down elective surgeries to make room and surge capacity if we needed it in hospitals. Therefore, we were redeployed. So nurse practitioners that normally were doing primary care ultimately started figuring out different ways to do primary care, be it through telephone calls or video conferencing. Other nurse practitioners fell back on prior training. For example, one person in my facility used to be an ER provider and then became a primary care provider. She returned to the ER during this time so that she was able to provide care in the emergency room when we had lots of people coming through the emergency room. Another nurse practitioner in my facility had ICU experience, so she actually went to the inpatient floor and started working as a staff nurse, and she was coaching and guiding staff nurses that had no ICU experience so that we would be ready for very sick patients if we needed them. The beauty of nurse practitioners is we have flexibility, and it's so nice to be able to be flexible and helpful and help in no matter what area it is, because we've got broad training. We also have a different training than MDs do in the sense that we start with a nursing foundation, and the nursing foundation provides holistic bedside care, and it provides that special touch that the MDs don't have in their training. They're great at what they do. I'm clearly not saying they aren't, but we have a different track, and it's a nursing basis. So for us, initially, we were able to flex and do all those different things. Now we're starting to go back into our previous roles. We've started seeing patients in clinic again. We're now reaching out to our patients at home saying, hey, come on back in. We need you to come in and take care of your chronic illnesses so you don't get sicker. We want to teach them about hand washing face to face. We're providing them with masks when they come in so they have them in the community. So we're all starting to transition back into our regular roles now here in Vermont. We're very lucky that we didn't surge. We did a phenomenal job of flattening the curve, and I think that made a big, big difference for us. I can tell you across other states, colleagues are in very different positions, but here in Vermont, we've done a great job.
Great to hear. I have been hearing a lot just through my own conversations and, in the news about, the difficulties of patients who have chronic illnesses that aren't COVID-19 and the ways that hospitals are facing those situations. But one thing I also want to ask you, Meredith, about what being on the front lines is like is, so much of what a nurse does is provide that warmth to patients to, make sure that they are not only their physical well-being is taken care of, but their mental well-being in a way as well. So what has that been like with having more patients and maybe not having all the extra time to do that?
So at my facility and at a couple other facilities that I know of, we actually ramped up mental health. And so we've got extra social workers coming in and seeing our inpatients while they're there. We also have gone to telemedicine with mental health. And so we are following patients frequently. Thankfully, CMS, the government that manages payment sources for billing purposes for providers, has opened it up so that we could be reimbursed for some of the telehealth that we're doing.
Mhm.
So that's been an avenue that we can reach out to our patients and help them. We have developed a Zoom support group at my facility for both staff and for patients, 2 separate ones.
Mhm.
And so we actually have community patients calling in and utilizing that support. On the front lines, our chaplaincy service also has gotten education from us providers about COVID-19 so that they can then speak with the patients and spend a little more time with them when we're tied up and busy.
Mhm. That's
Does
that's
that
great.
answer your question?
Oh yeah, for sure. I just,
Okay.
there's just so many different aspects of this issue. We could talk for days about it. But and speaking of staff mental health as well, I know that Cynthia mentioned in an email to me that she has been working on that issue. So Cynthia, would you like to maybe touch on that and just your experience of what it's been like in the field?
Sure. So, with this pandemic, we're all experiencing unprecedented levels of stress, I think, across the board, whether that's from somebody who's working directly with patients or somebody who's in a leadership role. So before this all happened, in my academic world, I was already kind of pursuing workplace stress as an area that I was interested personally. And I've always worked in the ICU, so I've worked in a high stress setting. And when this happened, things just really skyrocketed with people's stress levels, and it was really noticeable. And it is concerning to me. And, I try to keep a really close watch on my colleagues to see if there's anything that we can do together. And there are a lot of great resources that our facility has put in place, some of which Michelle mentioned, like Zoom support sessions with our psychology department. We have that resource. But I think that being that it's Nurses Week and it's Year of the Nurse, and we are facing this incredible pandemic situation, I am hopeful that this will allow the opportunity for more nurses to seek out mental health services if and when they need those. We're facing general anxiety and stress levels with inadequate PPE and fear of exposure to coronavirus, kind of no matter where you work. And then on top of that, the other big problem that I see is moral distress. And moral distress is a really important concept to grasp. And it's basically knowing what the right thing to do is, but not being able to do it. So an example of that I have experienced is having a patient that is at the end of life and they can't have any family members visit them. So what I did in that situation is I put the phone up to the patient's ear. They couldn't hold it, but I propped it up on a pillow and put it on speakerphone so that their family member could talk to them. Since then, we've gotten iPads, but that was in the beginning. But overhearing those conversations and hearing those kind of goodbye remarks is very heartbreaking. And nurses experience that all the time, unfortunately. And right now it's just a little bit harder. So there are a lot of great resources, though, and a lot of great strategies. I've been on this committee that is called Strength and Resiliency, and it's a national committee through the American Nurses Association. And so we actually originally were named a suicide prevention committee because there wasn't enough attention focused on that for nurses. So we were renamed Strength and Resiliency, which I think is a great name. We have a website. We have a ton of tips, resources, links to the American Psychiatric Nurse Association. And I think for me, my biggest advice for my fellow nurses is to try to find ways that you can help yourself while you're at work. There's a plethora of resources for when you're at home. You can exercise, you can write in a journal, and those are things that I like to do. But when you're actually at work and your stress level is 10 out of 10, find something that you can do to bring that down so that you don't burn yourself out. And one thing that I've shared in previous kind of webinar conference type things is that I've started doing this 2-minute writing exercise where I'll put a timer on my phone. If I have the opportunity and my patient is safe and I can take 2 minutes safely away, and I will just write everything that I can hear and sense. And it's a free writing activity that grounds me in that space, and it really helps my stress levels when I'm at work in the ICU. So that's my one tip. But. I could probably go on longer, but I think that we need to move on to other people, and I appreciate the opportunity to speak. Thank you so much for hosting this.
Yeah, I mean, wow, I literally cannot even imagine what that's like. And I very much so appreciate you sharing. And hopefully some of those tips will, help somebody out and, nurses out in the field. Well, we can also hear from Carol. I know that you, have some insight into what varying nurses of different backgrounds are experiencing right now. And if you could talk a little bit to that, that'd be great.
Sure, thank you, and happy Nurses Day to those, Nurses Week to those of you who have joined the call, and thank you to my colleagues that are doing such a wonderful job with this discussion. So, as I listened to Eileen talk to us about the history of Florence Nightingale, it's interesting to see the parallels that have emerged during this crisis, so that nurses have become the innovators. Nurses are the statisticians. They are the infection prevention experts. They are the ones who will adapt to the situation. And I think that's a really important concept for us to be thinking about, not only as nurses assume different roles in this crisis, but also it's part of the strategies around resilience, which I'll talk about a little bit later. And Cynthia described, some of the research that's already been done on resilience and some of the great strategies that are in place. But when you think about what's happening on the front lines, nurses who are traditionally specialists in a specialty, for example, a surge nurse or an operating room nurse, all of a sudden have been asked to provide care in a different environment. And a lot of organizations have become extremely creative in terms of using those nurses where they need them. So the OR nurses, for example, aren't doing surgeries, so they're running the drive-through clinics, the drive-through testing clinics, for example. Others are acting as a second shadow for the ICU nurses, so that they are observing the donning and doffing of personal protection equipment, keeping their colleagues safe. So it is a hallmark of our profession that when there's a problem, we innovate. We work around sometimes too, but innovation is really the best, because you hope that innovation has some evidence base to it and is able to be replicated and then disseminated throughout the profession. So it's just interesting to hear how Florence had to adapt to the battlefield and to the challenges that she had 200 years ago. And how nursing is really doing the same thing right now. And nurse leaders have had to adapt too. I represent an organization that has over 1,000 members from 5 states. And our members are academics, they're nurse leaders, they're managers, they're charge nurses, they're CNOs. And every single one of them will tell you that they are doing something different today than they may have been doing 2 months ago, 3 months ago, because they've adapted to the situation in the environment. And the most important thing is to keep our frontline nurses safe. And the only way to know if they're safe is to be out there and to be visible and to be listening and observing what they're dealing with, and then being the convener for the conversations like we're having today, and at higher levels to make sure that hospital administration and the incident commanders at the state level know what's happening on the ground. So it's really been an interesting study, if you will, to look at how nurses have responded to this crisis and will continue to do so. And I predict we will see different roles evolve as a result. Michelle mentioned the telemedicine and the mobile clinics, for example. I think we'll see more and more of that, because we finally realized that that is a really good way to help bring healthcare to the community and have the community be the locus of care, rather than always the acute care medical center that is the model that most of us were marinated in. But that's changed. So that, I think, is going to be a silver lining going forward. I'll stop there for now. Thanks.
Right. Well, you know, as we move the conversation a little bit more into the recovery process, I know, Michelle, you mentioned earlier that Vermont has done a really, really great job of flattening the curve. So could you talk a little bit about, you know, why that is and how we can maintain that flattening going forward and not see, you know, a resurgence of the virus in Vermont?
Sure. I think that, that's a very important topic. One thing we'll see as Governor Scott continues to open the state, we can expect we will see some more positive test results. That's to be expected. What we're hoping is that people will maintain some form of physical distancing. I like to use that term. Dr. Levine used it once or twice as well, as opposed to social distancing, because we really do need to worry about people's mental health now going forward, and people need to start interacting with people again. So we need to start re-interacting, but we need to maintain physical distancing. We need to wear masks when we're out in public, when we're around other people. We need excellent hand hygiene. And as we slowly start to resume what will become our new normal, these are things that are going to have to be at the forefront of our minds going forward. I think we will find that based on the data that I've reviewed, that some more people are going to get sick, and we can expect that. But what we have to understand is that if we start to have someone sick near or around us, then we need to provide distance again for that person. We need to get them to self-isolate for that 14 days. We need to use meticulous hand hygiene if you're around that person, and we need to support that person. I think as we start to recongregate in groups, I think it's going to be really important that we be thinking about these things and be a good steward. If you're sick, stay home. It's really important. If you're sick, stay home. Healthcare is open across the state. Please contact healthcare providers if you're not feeling well. And also, please, we need to get people with chronic illnesses. I said this before. We need to get them back out and seeing their providers so that they're not getting into a crisis and ending up in the hospital, whether it's with their everyday provider or it's whoever's running the walk-in clinic at their facility. They need to be getting out and getting it taken care of.
And if I could just add something to that, because it really goes with what Michelle was just talking about, is so for the last couple months, we haven't done any well child visits for pre-K kids, and immunizations have been put on hold, and not just for children, but for older adults also. And so it's really important that people understand that they should be contacting the providers again about getting the kids, getting their child back in to get those done, and talk with them about how that's going to look and how they can make it happen. I think that in some places they're staggering appointments so they don't have many people congregating in the waiting rooms, but they can still do that. But getting the other immunizations are so important as we move forward, because when we get into the fall, we're going to need to do flu shots again and other things. And so each thing that we do that's a layer of protection is going to be really helpful. But that's one where we as school nurses have really seen a large impact, is where like our 6th graders going in the 7th need to get a Tdap shot, or our pre-K going into kindergarten have to get their DTaP and MMR and varicella and polio. So, I mean, it's, those are really important, and I would hate for that to get lost in this mix.
Absolutely. And in opening schools and opening the rest of the society, we're going to need a lot of guidance as to what the best practices are. So it's really key, both in our schools around Vermont, but also, just in general society. But Carol, I know you mentioned that you want to touch a little bit on the recovery process and what that will look like. Do you have any thoughts that you'd like to share?
Well, I think Michelle really got us on to that topic when she talked about resilience. I'm sorry, it was Cynthia who talked about resilience and the team that she's on at her organization, which I applaud. I think that all organizations need to think about that. So there's a group in Washington called the Advisory Group, and it is a think tank and resource for organizations, healthcare organizations, especially nurse leaders, for strategies and ideas on how to manage various healthcare challenges. They did a research project about 2 years ago on the whole concept of resilience. And I think it's really interesting that what Cynthia was saying before is exactly what they found. So when they looked at resilience, which of course is the ability to recover and bounce back from a situation, whatever that stressful situation might be, they found that there were 4 major factors that cause the stress. The first is violence and workplace stress, which is exactly what Cynthia talked about. And the frontline nurses' need for safety. The second factor was care compromises. Cynthia talked about that too. The moral distress that you get when you cannot do what you know you need to do, either because your resources are not available or because the situation is extraordinary, which this one certainly is. The third factor was no time to personally recover. And I think that nurses in general don't do well with taking the time that they need to get a code lavender or to reach out to a colleague and say, I need to validate how I'm feeling about this day. And so we don't. We just keep soldiering on, so to speak, with the mantra, I'm fine, I'm fine, I'm fine. And I think that's a huge factor. Not just I think, but the advisory research said that that is a huge factor. And the last is, as we make improvements in our processes, they often sometimes will isolate nurses in that the care becomes protocolized in an effort to be standardized and to minimize variation. Things become protocolized, and the nurse can sometimes get isolated in that process. So we need to make sure that we include our frontline nurses in process improvement and redesign so that their input is considered when we do that. So that the advisory board also offered then 4 strategies for how to deal with this. And their strategies are: 1, at the front line, reduce the response time at the point of care between the threat, whatever the threat is, and the response. So that means that nurse leaders need to be visible, and they need to be present, and they need to be listening and seeing what's going on. The second strategy is to surface and address frontline perceptions of unsafe situations. Maybe it's staffing, maybe it's the design of the unit, maybe it's a process that doesn't seem to work well. But it's really important that we seek that feedback. And if the staffing's unsafe, we need to see it, we need to acknowledge it, we need to recognize it, and we need to work with the nursing staff to be able to address it. The third strategy is to make emotional support an opt-out only. In other words, we need to encourage our nurses to take advantage of the code lavenders and the resilience rooms and the EAP at the organization. And it's interesting, one of the strategies around resilience has to do with normalizing. That's sort of the first phase in resilience, is to normalize your experiences. And one of the best ways you can help someone else normalize their experience is by sharing yours. So if you go to a colleague and say, I really had a tough time with that family today, I'm feeling inadequate, or I'm feeling guilty, or I'm feeling whatever, that normalizes it for you, and it normalizes it for your colleague. So you kind of get a double effect of that. And then the last strategy is reconnecting nurses through storytelling. It is one of the most powerful things that we have in our arsenal, is the ability to tell stories. And that's what the Year of the Nurse has been all about, is the stories from around the world on what makes nursing nursing, what is the essence of the profession, and how do we tell our stories. And organizations that are designated as magnet organizations, that's how they get that designation, by telling their stories and the impact that the nurses have on the patient outcome, the family outcome. So I'll stop there, but I just think, as Cynthia said, we know a lot about resilience already. Now the work is to figure out, how do we start to infuse that into our organizations, into our associations, into our daily work.
Yeah.
I may just interject, if that's okay. I think that's part of the work that this coalition is doing. And the formation of this coalition is really empowering the leadership of the 4 organizations. And I think that having that voice and sharing the voices of our nurses, we did a survey in March and early April that did demonstrate some of the concerns that the clinical staff had at the front line. And we talked earlier about morale, and we talked about PPE, and certainly the impacts on the nurse of the stress in those environments when they don't have adequate PPE. So the voice that we're trying to bring also is the one not only from the nurses to the incident command center, if you will, because we represented there, letting them know what our nurses are telling us through the survey and anecdotally, and then trying to get that message back out. And on a positive note, earlier, we today learned that they are going to start expanding testing of frontline workers. And that will be significant in the sense that at least people won't be living in the fear. Are they, you know, have they been exposed, and should they be quarantined, and what are they bringing home to their families? Because it's not just the nurse in his or her role in the hospital. It's how they might be concerned about, in addition to self-inoculation, potentially contaminating other patients and or bringing something home to their loved ones that are already potentially fragile. So that stress is significant, and I think the opportunity we have among these 4 organizations as a coalition is to help empower nurses to be that voice for them, but also to help them with their own voice as nurses. And that writing that Carol talks about, I think, is really going to be helpful. There'll be a lot of stories from this pandemic. I kind of think sometimes, what would Florence do?
Yeah. Well, you know, and that's a really good point. That's a really good point. And I guess, you know, as we wrap up, I would love to just ask if any of you have any, you know, inspiring or creative stories of nurses that you'd like to share with the group. Anybody?
I'd like to just throw one thing out. I think that there is a group of nurses during this pandemic that we really need to reach out to, and that's our geriatric nurses. The geriatric nurses have been self-isolated with their patients now since early March because there has been no family members allowed in or out of any long-term care, community care, or communal housing facilities in Vermont. So these patients who are used to seeing their loved one day in and day out, these nurses have come up with some really amazing things. There's one group of nurses that put together a video of patients, of course with proper permissions, but put together a video of patients and sent it out to family members electronically. There's another group that gathered patients in common rooms and gathered families on the outside, and they had a sing-along through the glass window. There's these nurses and these activity aides in these long-term care facilities have come up with new ways to physical distance, yet involve their patients. Now they do a game of bowling down the length of a hallway in their facility. So they just have really been creative, and I think we need to give a big shout out to that group of nurses.
You're absolutely right. I want to just share, I really liked when Carol spoke about the battlefield that nurses have been through. And it really has been a battlefield, a war that nurses have experienced where some of them, half of them have been afraid to go to work and then to come home that they might have something, and 18% winding up positive with COVID in Vermont. So some frightening things for them, and the PTSD that follows up with that. And yet they've been so brave, and there's been such a collaboration that has happened that, you know, among the group that we've had, it occurred because of the need for accurate information and a quick response that was accurate and evidence-based that we could share with our colleagues. And there were some wonderful examples, like when Carol had nurses from Washington and Oregon that could share their experiences. And I think, again, that is going to happen when we start opening schools, that collaboration that could happen from other states, not just from our own state. And just we will have, as Michelle mentioned, you know, there will be a surge that happens. We all know that that's going to happen, and how do nurses deal with their fear with that, and how do they address it in the best way will be something that we share collaboratively. What's the best strategy? And I've heard of some wonderful stories. You talk about wonderful, inspiring stories. Hospice nurses that, like the Noyana singers, they're sending their songs to patients in like the respite house and places like that, so that they can share, even if they can't be there in person, they're sharing their songs and their voices to just help people and they're at their end times, and still volunteering in some way. I don't want to take long, but I did want to share that.
Yeah, thank you so much. Would anyone else like to add anything there?
I have just one really brief thing to mention, just in terms of like nurses being innovators. I think we have I think, Carol, you were talking about innovation, right? Nurses have been innovators forever. And I would definitely like to commend there's a team at UMass where I'm a student, and they designed this like laser cut plastic face shield that can be produced like by the tens of thousands. And the cool innovative part about that group was that they actually operated on Microsoft Teams, and they had engineers, they had people from like different material science departments. And so it wasn't just nurses, it was nurses working collaboratively with other disciplines. And I think that as we like begin to emerge out of this at some point, and maybe a part of that, you know, successful recovery period is going to be not just collaboration with nurses, but collaboration with many different disciplines. So yeah, and there's actually there's a hackathon coming up through I don't know which organization right now, but for nurses to join in and problem solve in live time over, you know, webinar spaces like this. So lots of things are happening. It's really amazing. I feel grateful to be a nurse. I feel grateful to be working with all of you, and yeah, just wanted to share that.
Maeve, if I could add something to that. So, you know, it's interesting. We have to remember that the Gallup poll for the last 18 years has identified nurses as the most trusted profession. The only year that we were not number one was the year of 9/11, where the firefighters were. But my point is that the public trusts us probably now more than ever. I mean, I had a neighbor knock on my front door today, who is the executive of a manufacturing company here in my part of the state, with a contraption that he and his team at the factory had put together. It's a breathing type of apparatus, and said to me, "You're a nurse, you're on the board of the hospital. Do you know anybody who might be able to look at this and tell me whether this is a good invention? Should we pursue this? Should we make some more of these? Could they help the nurses?" And that's, I think, a story that exemplifies how the public does trust us. And they look to us to say, are we on the right track? How can we help? What can we do? I was astounded to see him standing at my front door. And I will talk to the respiratory department and see whether or not it's something that they think they can use. But never forget how much the public trusts us, so than ever.
I just found the hackathon that I just mentioned is through Microsoft, Johnson & Johnson, and the Society of Nurse Scientists, Innovators, Entrepreneurs, and Leaders. So I'll share it in an email so that you guys have that information. Great.
And I was just going to share, when you're talking about being respected, I went to a tire store, and it was right after the Addendum 11 came out to the executive order that required businesses to actually wear masks. I talked to the folks there, and I said, you know, this just came out yesterday, but this is what the addendum said. And we talked for about 10 minutes, and I just talked about what A through L meant, and what, you know, the training, where to go for the training. And I was told at the end, is like, you know, you told me more in the last 10 minutes than I've gotten out of the last 4 press conferences. And I was just, and I was just from the standpoint of it's for everybody's protection to have a face, to wear a face covering and to protect them and to protect folks that are coming in, because everybody came in that when I was there, they were all wearing face coverings, but the folks inside just didn't even know. They didn't realize that that was a requirement. And it was, it was the next Monday when it was actually going to be fully effective. So, but he knew me from previously and trusted what I was saying is I wasn't just making it up to be a jerk or something. And it was really great. It was a really cool interaction, and it made me chuckle a little bit, but made me feel like I was adding some value after I gave him a whole bunch of money.
Well, speaking as a layman, general member of the public, I feel that trustworthiness within myself and that gratefulness for all that nurses of every background have been doing. And I'm really grateful we were able to have this this webinar to come together and hopefully spread some information and celebrate International Nurses Week together. But before we finish up, would anyone like to just add anything else before we close out? All right. Well, thank you so very much, and I wish you all the best of luck going forward. Thanks.
Thank you for having us.
Thank you.
Thank you very much. It was great. Appreciate it.
Appreciate you.
All right. Bye-bye.
Bye.